Hi everyone, thanks for having me and thanks for the introduction. So as you probably know, I'm going to talk about the psychological and social impact of living with eczema. I am a senior research fellow and a health psychologist at a research centre called the Centre for Appearance Research, which is based in Bristol at the University of the West of England. And my research generally focuses on the psychosocial impact of living with conditions, chronic health conditions, but also conditions that affect how people look in some way. And a lot of my work focuses on dermatological conditions. And I have eczema is kind of a real interest of mine because I also have eczema and I've had it since I was a child, but I still have it now as well. So I have a personal interest in it as well and understanding of what it's like to live with eczema. So to start with, to kind of get us going, I just want you to think, if you have eczema personally, or maybe if you've cared for a child with eczema, how does that impact your or your child's life? Maybe just for a second, think about the kind of broader impact beyond the physical symptoms and managing it. How does that affect your life? I can see some people nodding. So hopefully that kind of resonates with you, that eczema is a condition that affects lots of aspects of people's lives. And I think we often hear one of the things that people find really frustrating when they have eczema is that it's really misunderstood. Often people will say things like, oh, it's just dry skin, or, oh, I had a bit of dry skin. And obviously it's much more than that. It's an immunological condition, and it can be something that's really difficult to manage and really can take over lots of aspects of your life. But it's not always seen in that way, and it's not always seen as a long-term condition by all health professionals either, particularly, for example, if you might go to see your GP. Perhaps you might feel that there's not such an understanding of the fact that it is a long-term condition that we have to manage, and even when our skin's good, it's still something that needs to be looked after. So I've put on the screen some of the physical impacts of eczema, so things like pain, itching, discomfort, dryness, affecting things like sleep, potentially risk of getting infections, and it's also obviously associated with things like allergies and intolerances. But actually, there is a massive broader impact of eczema as well. So I've put up some examples here, but I think this is not an exhaustive list. There's a lot more. But just to kind of give you a flavour of the broader impact of eczema, it's often associated with stress, anxiety, depression. It can affect your mood and make you have negative mood. It can also affect things like life engagement. It can be physically quite constraining on people and affect how we socialise and things that we can actually do. Eczema obviously can make you look different from other people, and people can feel really self-conscious about this, and it can affect how we feel about our bodies as well, our body image. It can lead us to be socially isolated and avoid certain activities, and feel really self-conscious. And actually the fact that eczema can be really unpredictable and difficult to manage can make us feel like we've got a lack of control and feel really helpless as well. And it can also affect things like our concentration as well. So these are just some of the things, but obviously, as you can see, it's got this massive invisible impact that somebody wouldn't necessarily see when they're looking at you and your skin condition, but actually the physical things might only be the tip of the iceberg for you. And we know that mental health is a big concern in people with eczema. So some studies have showed that compared to people without eczema, those with eczema have an increased risk of developing anxiety at 68% increased risk, and 64% increased risk of depression. So obviously these are really significant and important things to think about when people have eczema, and to think about supporting rather than just treating it as a physical condition. We need to think about these broader psychosocial impacts too. But actually, even though anxiety and depression are really important to consider, eczema can have a big impact on your psychological and social well-being. Regardless of mental health concerns, it can still have a big impact on our lives anyway, even if we don't feel particularly that we have depression or anxiety. There will still be this psychosocial impact on us that can affect our emotional well-being and our quality of life. So I think most people here will probably resonate with the fact that keeping control of eczema is a massive part of living with it as a condition. Eczema can be really unpredictable and difficult to keep control of. even if we do everything right and follow our treatment plans really to the T, sometimes we can still end up having flare-ups, and sometimes we feel like, we don't know why that happened, or we might be able to see certain times that we know it's just going to be more difficult to manage our skin. So for example, spring's coming up, pollen can be a really big problem for people, but also saying things like cold weather. So actually it's something that we often might place a big responsibility on ourselves to manage eczema, but actually often these things can be out of our control to some extent, but that can be something that can really be very stressful and really affect us. Obviously, there's also lots of treatment with eczema, which can be really can be unpleasant, can be time-consuming, can be quite complicated. Having to get on top of using multiple treatments, using them throughout the day, using different things at different times, depending on if you're having a flare-up or if you're just trying to maintain your skin, for example. We also hear people talking a lot about frustration around the trial and error of trying to find something that works. There's not necessarily a silver bullet that works for everybody, and people have to try multiple things to find out what might work for them. Sometimes that might involve going back to see a health professional again and again until you get a treatment that you think works for you. And obviously this can be really, really frustrating, and something that is a big burden of treatment, and something that you have to deal with on top of other aspects of your life as well. And then, as I mentioned before, this sort of lack of control and feeling helpless can often be something that comes with having eczema, but also if you're caring for a child who has eczema, feeling like you're not really in control, feeling really overwhelmed, and potentially not feeling very supported and quite helpless. So those are some of the really big things that we often hear about from people in terms of the psychological and social impact of managing eczema. And all of this can be very stressful. It can make us feel really worried and really anxious. It can often sort of consume us, constantly thinking every day and with everything we're doing, is this something that might make my eczema worse? Should I go swimming, or should I do this? Or will it actually cause me to have a flare-up? Should I eat this? These are things that might often play on people's mind and make them really worried, and often that can take over really and stop us from enjoying things because we're focusing on this all the time. And it might also really stop us from engaging in lots of things in life because we feel like we need to avoid things that might make eczema worse. And obviously these things are kind of often sound like they're sort of protecting us or helping us, but actually they can just make us feel bad, and they can stop us from doing things that we want to do and take the enjoyment out of things. And we know that there's a big link as well between stress and eczema. We know that if you're having a flare-up or if you're having difficulty managing your condition, this is likely to make you feel stressed. But we also know that being stressed actually physically exacerbates your symptoms and can make flare-ups worse. I don't know if this resonates with anyone here, but thinking about times when you're really stressed, that's often a time when you're then likely to have a flare-up. And also if you're stressed and you've got a lot of stuff going on, you might then find it more difficult to actually look after your skin and adhere to your treatment. So we can get into this really vicious cycle of stress and eczema, which can be really difficult to break out of, and again can make us feel really out of control and like there's, and that is something that's, really difficult and really unmanageable, and we don't necessarily know where to begin. And this can obviously have a really big impact on how we feel and how we engage with other people and how we feel about ourselves. And so I talked a bit about having worries around having eczema. And it's really common to have, and this isn't just relating to eczema, but just in general in life, it's really common to have worries or negative thoughts that just pop into our head automatically all the time. Often we don't notice them. But often these thoughts might seem on the surface like they're helpful things, but they actually might not be particularly helpful for us. So I've put some examples here. So these are some common worries that people with eczema might have. So feeling like I'll never be able to keep control of my skin is one. I'll never find a treatment that works for me. If I go to the meal, I might eat something that makes my eczema flare up. Or, for example, if I go swimming, everyone will see my eczema and then they won't want to be friends with me. That can be a really common one that we hear children talking about, but obviously can affect anyone. So on the surface, these thoughts seem quite protective. We're trying to protect ourselves from making our eczema worse or from being in a position where we feel really self-conscious. But actually, all of these thoughts can really consume us, really get in the way and stop us from doing things we want to do. You know, if it stops us from going swimming or going for a meal, this is obviously a big problem and can contribute to affecting our quality of life. So actually, these can really take over, they can make us feel worse, so they can actually, these thoughts can actually affect our feelings, but they can also affect our behaviours and what we're doing as well and stop us from doing things. And it's really common to have these thoughts, and as I said, we don't always notice that we're having them, but we do pay attention to them, and often if we have a thought and it makes us feel a certain way, we believe it's true and we think, okay, you know, I'm feeling worried about this, so I shouldn't do it. But actually it might not be helpful for us, and we might need to pick these thoughts apart a bit more and think about whether they are helpful or unhelpful, and trying to change our thinking. And these, on this slide, I've got something called thinking traps. So this is from a resource on Eczema Outreach Support's website. But these are just some common thinking traps that we all fall into a lot. So things like, that might be particularly relevant for eczema is things like fortune telling, so thinking that we know what's going to happen in the future even though we don't. Being very black and white about things, so thinking if I go and do this, this will definitely happen to me. You know, if I go eat this, eat out at a meal, it will definitely give me a flare-up, for example. We often filter, so we focus on the negative things rather than also focusing on the positive. So we might think, oh, once when I did this, it made my eczema worse, so it's definitely going to happen again. But we're actually ignoring all the times where we did something and actually it didn't have an impact on our eczema. Also, that emotional reasoning that I talked about. So often, if we feel worried about something, we'll go and change our behaviour based on that, whereas actually, you know, there might not be a real reason for doing something. If we kind of pick apart our thought and think more logically, it might actually, you know, it might not be as worrying or concerning as it feels. We also might overgeneralise things and personalise things, so attribute everything to being our fault. This is a really common one, thinking that it's always our fault if we can't control or manage our eczema, when actually, you know, there's lots of factors that are going to be associated with having a flare-up, but it's really easy to personalise and blame ourselves and feel bad about that. And another big one that you might have heard of before is catastrophising, so thinking the worst thing's going to happen if we do something. And these kind of thinking traps we can all fall into them, and they can just have a massive impact on our lives and what we're doing. But one thing that can be really helpful is learning to notice those thoughts and think about if they're helpful or not, and trying to reframe them so that they are more helpful. So this is an exercise called Catch It, Check It, Change It. So the first thing you need to do is you need to notice the thoughts. So for example, being a bit more conscious of when we might be having them, maybe even writing them down. There might be certain thoughts that you realise you're having a lot that you didn't realise before. So in this case, I've used the example of, if I go to the meal tonight, I might eat something that makes my eczema flare up. So now we've caught it, the next step is to check it. So thinking about the evidence for and against this thought, how true is it? Is it actually helpful? So if we don't go for the meal, is that helpful? Or will it actually just mean that we feel really left out because we haven't gone out and seen our friends or family, we haven't celebrated something, we haven't had experiences that we want to do because we're worried about them? And are we falling into any thinking traps here? So for example, are we being a bit black and white with our thinking, or are we maybe fortune telling? We don't necessarily know if that's going to happen. And then the third step is to change the thought, to make it more helpful. So for example, with this particular thought, we might think, well, I've been for meals before and I haven't got a flare-up, so I don't necessarily have any evidence that this is going to happen now. Even though this is something that's a worry for me, if I check the menu, I can make sure that I'm trying to minimise that risk as much as possible, and that's all I can really do to control it. And actually going to see my friends will be fun and worth doing, so it's worth me doing that. So that's just an example of how you might use Catch It, Check It, Change It to think about your thoughts and to help you do things that are important to you, rather than sort of letting your worries stop you. And there's also lots of other things. So Catch It, Check It, Change It is based on something called CBT, or cognitive behavioural therapy, that you might have heard of before. But there are lots of other things that might be helpful. So for example, some people find it really useful to do relaxation and breathing exercises. So things like gradually relaxing different parts of our muscles, that makes our body physically relax, and then that can help us to feel better and feel less stressed and anxious. Mindfulness is another thing that's got lots of evidence that it's really helpful, and even quite short mindfulness exercises of, say, 10 minutes or something have been shown to be really helpful and make people feel better, improve their mood, improve their self-esteem, that kind of thing. Also, really basic things like doing some kind of exercise or just going outside, like today's a really beautiful day here. Going outside and walking around, that can make us feel a lot better. Also, social connection and peer support is a really big thing. So obviously, where we are today is a really good example of that. Meeting other people who have similar experiences and validate how you feel we know that that's really important. That's seen as one of the most helpful things for people with conditions like eczema. Actually, having support from medical professionals is obviously really important, but actually people often value just as much or sometimes even more speaking to other people, sharing their experiences and feeling less isolated. So things like NES are really important for that. I think also not being too hard on yourself, so not doing that thing where we're personalizing everything and taking the blame if we're not feeling very good, kind of just understanding that that's normal. We're not always going to feel great all the time. We're not always going to be able to perfectly manage our eczema all the time. So I think reminding ourselves of that is useful. And also practicing these things when you are feeling good is really important. So I suppose it's a bit like if you hurt your back, for example, and you go to a physio, they give you exercises, your back's better. But then what normally happens is you then forget to do the exercises, don't you? And then your back gets worse again. You think, oh, I should have kept doing it, and then my back, would be in a better position. So it's really similar with these kind of things. If we can practice these sort of exercises when we are feeling good, actually it's protective and can stop us from feeling from feeling really bad or having so many challenges. So I've put a picture on here of the Eczema Care Online website, or ECO, which is a really good resource. And there's a whole page on there about stress and eczema, which has like relaxation exercises and lots of things. So that could be something really useful to have a look at. And also, particularly for children and young people, I was involved with designing some materials for the charity Eczema Outreach Support around well-being, which includes lots of these exercises like catch it, check it, change it, but there's lots of other ones around self-esteem, dealing with worries, becoming more confident. So that's another resource that's online that people might want to look at. And this is just the Eczema Care Online full slide. So Eczema Care Online was developed with lots of people who have eczema. I don't know if you've heard of it before, by researchers, I think based in another part of the UK. And it was developed with over 200 people with eczema, and it's got evidence of being really helpful for people managing their condition. So this might be something that would be useful to look at as well as a website. Okay, so another big thing that we often hear, and particularly from children, young people, but definitely from adults too, is having a condition that can affect how you look, unfortunately can lead to reactions from other people. A lot of the time people maybe just don't know what eczema is, and they're not necessarily meaning to be unkind, but unfortunately people sort of staring or asking questions, making comments is really common. And for particularly children, young people, teasing and bullying relating to appearance is unfortunately really common as well. And obviously, this can be really upsetting. It can make us feel really self-conscious and worried about how we look, and affect things like our self-esteem. Again, it can stop us from doing things, for example, wanting to cover up, not wanting to do PE, or not wanting to go swimming, or not wanting to wear certain things if we feel like we need to conceal our condition. That can be really difficult as well. So common things that people might say is, what's wrong with your skin? Or can I catch that? I don't know if anybody's ever experienced that. But we hear about this a lot. And actually, these experiences can have a really big impact on people. And really, this is a problem with society, isn't it? It's a problem with there not being enough awareness of eczema, and people not knowing how they should respond or talk to other people. And actually a lot of the work that I do is around trying to work out how we can reduce stigma towards people that have conditions that affect how they look. and raising awareness in a meaningful way, and using things like social media in a helpful, positive way to educate people. So that's something that I do, and that really is where we should try and put the onus rather than on people to cope with this. But in the meantime, because obviously this is a really big thing to try and do, there are some things that can be really helpful, particularly for children at school. And one of them is just planning a response. So often a lot of worries that people might have and wanting to avoid things is because they're worried about being put on the spot and being asked questions and not knowing how to react. But actually, if you can plan a response, that can give you some of the power and make you feel more comfortable in dealing with these kind of questions. So it will really vary. Some, people have different preferences related to how they want to respond in these situations. But one thing that you might want to do is shut the conversation down and change the subject. So say, I have eczema, it's a skin condition, you can't catch it, I look after it using moisturizers, and then change the subject, for example. But other people might want to respond confidently and might want to use that as an opportunity to educate people about eczema. So obviously practicing that at home with your parent or with a friend could be really helpful. Another thing is telling people before they ask. So if you feel like somebody might ask you or make a comment, interjecting, getting in there first, and educating people can be good because it can give you control of the situation, and it can also put everybody at ease. So that is another option. And then things like asking a friend or family member to help could also be really useful. And obviously you might respond in different ways in different situations, depending on if you know somebody or what situation you're in. But planning these kind of responses can be really useful. And again, for children and young people, on the resources I talked about earlier, on the Eczema Outreach Support website, there is worksheets for doing this for children, which could be useful. So another thing which is massive in eczema and that I've been asked to talk about is itch. So obviously eczema can be really itchy, and you can get into this really vicious itch-scratch cycle. And obviously when we're itching our skin, it can make eczema worse, so it makes it more sore, it can make us more likely to have infections, but often it's really difficult not to itch, and you might not even notice that you're doing it, but it's something that kind of takes over and is happening all the time, and it can be really distracting, can really affect your sleep. It can be a massive thing. So one thing that can be really useful in terms of itch, that there's some studies going on at the moment developing some programs to help people do this, is learning to notice when you're itching and then replacing the habit, essentially. So it's something called habit reversal. But this is something you could just try if you're interested. So firstly, trying to notice the itching. So often we're itching and we don't even know we're doing it. So trying to be a bit more conscious of when you're itching, how often you're doing it. Also, are there particular times that you're doing it? So for example, is it at night, or I don't know, is it after you've washed your hands? And if you can do this, you can become more aware of actually doing it, because a lot of the problem is that we feel like we can't control it because it's something that's just happening. But actually, if we start to sort of notice and monitor when things are happening, that can be really helpful. Obviously, if you notice there are some things that are triggering and that, you can maybe change those. So for example, if you're itching because you're really hot, you might turn the heating down or have a fan. It might be that you're itching because of pollen, so maybe you would take antihistamines or cover up your skin when you go out when there's a high pollen count, for example. But also what we could do is then try and replace the itching with something that's less harmful to the skin. So rather than itching and damaging our skin barrier more, you might replace it with something like pinching it or making a fist instead. That can be really helpful. And also trying to distract yourself. So sometimes eczema is just really itchy and it really kind of consumes our mind, doesn't it? But actually you might be able to distract yourself by doing something like making it cool with a cool pack, or using a fidget toy or something like that. And there's actually, I don't know if anyone here is already involved with this, but there's the rapid eczema trials that are being run in Nottingham and funded by the NIHR, and I'm part of that team as a health professional expert. But this is a really cool program. They're trying to answer some of the key questions around eczema really quickly, so that I think often when we do research, it can take years and years to actually do it and then see a benefit. But with this, it's all happening really rapidly and they're helping people. So there's one looking at keeping control, But the one that I'm involved with is about psychosocial well-being, and they are focusing on evaluating an itch intervention. So this is the trial is being developed at the moment, but this is something that people here might want to be taking part with. So visiting that website and signing up to the newsletter and maybe having a go at enrolling in the trial that tests this intervention is something that you might want to do. Another really key area, and again something that was mentioned to talk about, is family dynamics. So obviously if you have a child with eczema, it can really impact lots of things. It can really take over your life and not just affect your child who has eczema, but it can affect the whole family. So it can affect things like daily routines, from having to spend lots of time doing treatment, adjusting meals, for example, to try and avoid certain foods. And parents often say that they might feel guilty because they feel like they're focusing a lot of their time onto their child who has eczema and not so much on their other child or children. So this can obviously be something that's really stressful and frustrating, and is something that we hear about a lot. So this again is not an exhaustive list, but these are some things that might be helpful to do in terms of the family, to kind of help with family dynamics and the impact of eczema on the whole family. So I suppose the first thing is probably just to validate your feelings. So it's okay to feel fed up and frustrated and disappointed. That is just part of it. It's rubbish, isn't it, when you have to, having to change plans or having to spend a lot of time doing things that we don't want to do. It is something that sometimes we will feel bad about, and that's okay. We don't always need to try and fix everything. We can just feel like that. But also having kind of open communication. So for example, with other siblings, if they're frustrated, being honest with them about what's happening and why, and encouraging them to open up and share their feelings as well so that they feel validated can be really helpful. Also being just realistic. So when you're managing a chronic condition, it can really eat into lots of time, and sometimes we might feel guilty and try to kind of do everything and not let that get in the way of things, but that isn't always practical, and it can be really exhausting, and it can also be disappointing then if things change and we can't do all the things we want to do. So sort of being realistic and planning and doing certain things, like fun things, but also being kind of realistic about how much time things will take is really helpful. Also making siblings feel included. So some research has found that helping a sibling to feel more included, often they might feel kind of isolated and like they're not involved. So maybe even giving them a role in the treatment, so getting them to help get creams out, for example, and setting aside time to do activities with them that aren't related to eczema. So for example, maybe going to the cinema or going to a cafe with them, setting aside that particular time can be helpful. And then another thing that's really helpful and is based on something called acceptance and commitment therapy, or ACT, which is something that we use in psychology, is focusing on values or what's important to you. So obviously, as we've said, looking after eczema can be really time consuming, and it can get in the way of doing things. And there's not much we can do to change that, but focusing on what's really important to you as a family and thinking about how eczema impacts that at the moment, and then what you might be able to do, even if it involves adapting it or living with some restrictions, but what you can do to make sure that you are still doing the really important thing. So it might be just identifying one thing or maybe 3 things that are really important to your family. So it might be, for example, spending quality time together as a family, and thinking, how can we fit that into our life around eczema? So it might be, we're going to have an hour every Sunday where we all do this together, for example. So hopefully still being able to do things that are really important and making room for those, even if it means that maybe we have to compromise a little bit or adapt what that means for us, but still being able to fulfill it. And one of my colleagues, Maya Thornton, is actually doing some research about the impact of different conditions, including eczema, on siblings. So in this study, she's actually talking to people who are aged between 16 and 25, who are siblings of somebody who has a condition like eczema. So not talking to children in this sense, but this study is there's not really been very much research looking at the impact on siblings. So this will be a really good first step to understand their experiences, and then obviously lead on hopefully to developing support resources and more guidance, because there isn't very much at the moment. So this might be something that you or somebody you know is interested in and might want to sign up for. And then I've also been asked to touch on neurodiversity. So things like autism spectrum disorder and ADHD. And I guess it's important for me to say I'm not, I'm a psychologist, so I'm not going to go into the neurological and neurodevelopmental aspects. But we know that there is research now saying that there is a link between neurodiversity and eczema. And for example, children with autism, for example, might experience eczema in differently to children who don't have autism. So for example, they might be really hypersensitive to the sensation of itching. It might be really challenging for them. But also there might be some difficulties around tolerating sensations around treating eczema. So like the texture, for example, of creams, the smells of creams might be really difficult and challenging for some children. And also the changes in routine. So if you're having a routine that's changing, if you're having to try lots of new creams and moisturizers, that can be really upsetting if routine is changed. So again, just some very sort of basic tips that might be helpful. The fact that it's important in that case to find treatments that work for you or for your child. So for example, you might be able to use a spray emollient instead of a cream. That might be something that's more tolerable, and it's important to talk to a health professional about that and putting kind of that first over using something that seems ideal in terms of treatment. Actually, sometimes it's better to try and find a balance so that it's something that's manageable, and yeah, so you're more likely to be able to use it. Keeping familiarity and routine where you can. So for example, maybe even if eczema treatments change, always putting them on in the same places and a place where your child feels really comfortable might be really helpful. Gradually introducing new treatments, so rather than completely changing everything, if that's really difficult for your child, then trying to gradually introduce things slowly and again in familiar places and a place that your child is comfortable and feels safe. Pairing it with positive experiences as well. So for example, one of the studies that I was reading about this, and also there's some information online, talks about things like giving stickers or pairing it with a positive experience. Again, things like distraction toys, so like fidget toys, which I talked about before, can be really helpful to divert away from sensations of things like itching. And also focusing on well-being as well as following a treatment regime, so realizing that it might not be possible to follow it in the most perfect way, but trying to adapt it so that you can use it, but actually that your child's well-being is kind of put first is important. And then as we're coming sort of nearer to the end of the talk, I'm moving into the last few topics. Speaking to health professionals is another thing that we always get asked about a lot. So people with eczema often feel they're not being listened to. They might have lots of worries about how long their treatment will work and if it will work. So they might have found that they use things that really helped and then they stopped working. So people often feel quite worried and sometimes don't always trust health professionals. Often, particularly in terms of going to see a GP who doesn't necessarily have really specialist knowledge of eczema, people might feel that eczema isn't particularly well understood. And people tell us a lot that they often feel that the wider psychosocial impact that we've just talked about in this session isn't always understood. So really treating the physical symptoms but not thinking about the broader aspects and how that might influence somebody's life and how treatments might play into that. So if you're prescribed certain things that they might have a massive effect on your well-being if they're really difficult to use. Also feeling very overwhelmed, so being given lots of different types of treatment to use in different situations, coming away feeling like you can't remember what you were told, and also that it's very unmanageable to think about when to use these things. And often this can stem from not being involved in the decision making around treatment, so being given things but actually not being given a say in how you use treatment. So that can be a really big thing as well. So in terms of speaking to health professionals, these are just some general tips. So it could be useful to speak to your surgery and find out if there is a GP who has a special interest in skin conditions or in eczema. Sometimes people have more, there might be a particular person who has more training and is more up to date on different treatments. Also, you know, maybe speaking to somebody who has a special interest in mental health as well, depending on what you're going for, that can be really useful. Sometimes you can book a double appointment, so normally you get about 10 minutes, and obviously that's a very short period of time to talk about things in detail, and people often feel like that's not enough. So seeing if you can book a double appointment can be helpful. And also writing down questions beforehand. Sometimes you might get to speak to somebody and then you feel quite overwhelmed, or you just, everything goes out of your head and you forget what you wanted to ask. So writing things down beforehand, including specific questions, can be really useful to help you remember during an appointment. Also, just remembering that talking about how eczema impacts your well-being and asking for support is definitely something that you should speak to your GP about. People sometimes feel like it's trivial, or they don't want to waste their GP's time, or it's, you know, it's not something that should be focused on because they're there to focus on the physical aspects. That's not true, and particularly as we know that the psychological impact can affect how we physically manage our condition and how we feel. It is really important, and it is definitely something that you can speak to a GP about if that's something that is important to you. Also, asking for clarifications on treatments and what to do in different circumstances, asking those questions so that you feel informed and not overwhelmed, and bringing things like care plans or existing treatment notes so that you can work from those and discuss what works best for you. So I don't know if anyone here uses a care plan, but I've put an example on the side of a care plan that I was involved with making for children and young people, but they can be used for adults as well, and there are lots of different ones available online. But care plans break down your treatment to be really specific. So we can see here, it breaks it down into what you're using, when, how much, what part of your body, for how long are you using it. For example, what to do when the skin is, when your eczema is quite well managed, but then what to do when you're having a flare-up, and what to do if you think you might have an infection, for example. And this can be really helpful just to clarify treatment, but it also facilitates shared decision making and can make a health professional ask you questions about how likely it is you'll be able to actually adhere to a certain treatment regime, and if it's not, how can they change it with you to fit around your lifestyle. And these particular plans also ask about things like itch, sleep, feeling self-conscious, and life engagement. So that is hopefully prompting a GP or a dermatologist to actually ask you about how it's affecting you more broadly rather than just the physical things, to open up that conversation and hopefully encourage shared decision making. So that's all my content. The last few slides are just a few resources that you might find useful. So one thing is that where I work in the research centre, I'm in the Centre for Appearance Research, we're launching a hub in the summer which is going to have all the resources that we've developed, so lots of interventions and resources, all in one place that are free to access, and that's happening in summer this year. So that might be something you want to have a look at when it comes out. You can join our participant pool to find out about research that we're running, but also to find out when this hub is live, and so you can look at self-help resources. One of the things that will be on there, but you can also access separately, is a functionality intervention that I was involved with developing and adapting, which relates to body image. So the premise is that often when we focus a lot on how we look, we can feel really unhappy and compare ourselves to other people. But actually, if we focus on what our bodies can do rather than how they look, there's lots of evidence that makes us feel much better, and it can affect our mood and lots of aspects of our health and well-being. So this is an intervention for people who have conditions like eczema, and it involves writing about what your body can do rather than how it looks over the course of 1 week, and that's free to access. We also have an intimacy intervention that we're developing for people with conditions that affect how they look at the moment, which involves listening to podcasts. So it's something you can just do when you're going about your day-to-day life. But if intimacy or romantic relationships is something that affects you or is something important to you, you might want to sign up and help us test out this intervention. We're testing and developing it at the moment, and then once that's been tested, that will also be available on the hub that I mentioned. And then hopefully be able to share these slides, but I've just put together some links of different things that might be helpful for people to look at. But yeah, so that's it from me. Thank you very much for listening, and if you have any questions, I'll be happy to answer them.
Yeah, thank you. That's very interesting. I think you always learn things at these talks, and so the care plan, not thought of that, and going to the doctor with a list of what you do when, I know has been really, really useful for my daughter's eczema. So if anyone would like to ask a question, please. Yes.
I developed eczema only 2 years ago, and I've been through the lot, the doctors, the specialists, the allergy testing, the biopsies, the whole bit. And I think I've been very taken aback by the fact that neither the GP nor the consultant, the specialist dermatologist, the allergy guy, nobody made a link between the physical aspects of eczema and the psychological aspects of eczema. Not one has ever mentioned, even things like when I said, is there a link between eczema and stress? You kind of know there is, but I wanted to get the full answer. And they just bypassed the question completely. And I don't know if that's because clearly when they tell you stress is causing eczema, it just makes you more stressed. And it's one of those circular kind of dynamics that's very unhelpful, but probably true. But I've been amazed at how little support there is. So so it's Kate, is it?
Ella.
Ella, I'm so sorry.
That's okay.
Ella, when you said it was in a different section, it was in the section you were talking about families, but when you said validate your feelings, you have a right to feel a bit down or fed up or whatever, that's the one that's going to stick with me, that you have a right to feel how you feel. And even though, because it is a battle, it's an ongoing battle. But I just thought I'd mention that.
Yeah, thanks for sharing that. And yeah, I think it's really, what you say is very common. So I think a lot of health professionals, they don't really have training on the psychological and social aspects of eczema. And that's something that I would really like to do more research into and develop training. So hopefully we will have that in future. But yeah, and often when we talk to health professionals, they either don't have very much time with somebody, so they feel like they can't go into it and they get worried about opening a can of worms. Also, often they feel like they're not then prepared to help. So I think sometimes health professionals might know that it's important, but they don't feel personally qualified to help, and they don't know where to signpost people. So instead they don't mention it, which obviously is not helpful because it's not validating. It can really minimize your experiences, and as you said, it's not dealing with the whole condition, it's not dealing with things holistically. But yeah, I think there's just not a lot of support for health professionals in terms of how to broach those things. Obviously they might refer you to charities and different websites and things, but yeah, I think often it comes from a place of feeling worried about asking and not doing it, but obviously that's not a reason not to do it, and it might be having a really big impact on somebody. So it's really important to address, isn't it? Thanks.
Can I ask you a question that's linked to that one actually? We know that a lot of people struggle with the psychosocial impact of eczema, but when you go to a GP or a dermatologist, and you'd like to think the dermatologist might be more sympathetic and knowledgeable, but it's really hard sometimes to broach that question. And the healthcare professor is not saying, how do you feel about your eczema? So then it's not being initiated by them. So you feel like you're almost like making a nuisance of yourself by asking about it. And so the onus is on you to kind of almost, but if you've got any suggestions for how someone can, I suppose, initiate that, because there are things out there like CBT and other interventions that might be helpful. And there are talking therapies in the NHS that you can self-refer. And those can be quite helpful, but a lot of people don't know about it. So you need to almost find a way of, kind of building up the confidence or have some way of engaging with the healthcare professional to initiate that.
Yeah, that's a really good question, and I think you're right. They should, in an ideal world, you should be asked, how is this impacting your life? But often it doesn't happen. Yeah, so I think unfortunately we do often have to advocate for ourselves and go in, and that can be a really scary thing, or we might not know where to even begin with it, or we might feel like it's not the right place to do it. And also I think often people might feel like, oh well, I'm struggling, but I don't feel like I have a really serious mental health problem, so this probably isn't for me. It's not important, but it is important. I would say if you're going to go and broach those things yourself, maybe doing your research first, looking at different charities, looking at how eczema can impact people to help you think about what you might want to talk about, and also going in with something just even written down, so writing down how eczema affects my life, this and this aspect of my life can be really helpful. And asking, people sometimes say that the psychological aspects have a bigger impact on them than the physical symptoms, but I think maybe health professionals aren't always aware of that, so actually spelling that out to them, saying this is the biggest worry that I have, this is the biggest concern for me, what can you do to help me, where can you refer me? Asking those questions is helpful, even if it can be a bit scary, so perhaps preparing something to go in with is really useful. Or even saying, look, on this charity website there's information about this is how I feel, what can you do for me? I think also that can be where things like using a care plan like the one I showed can be useful. So with the care plan that we developed, we put the things like how it's affecting your life engagement and kind of your well-being essentially. So going in, and if you fill that in before and saying to the person you're speaking to, look, can we use this plan? It would be really helpful for me to make things clearer. And then them seeing, oh, okay, so it's really affecting this and this. That can be a really good way to start and initiate the conversation. So hopefully that would help. But yeah, it's a big thing to feel like you have to do yourself. But going in prepared and knowing that is a legitimate thing to ask about, and just letting them know how it impacts your life, and saying what can you do to help me is the first step. Does that answer your question? Yeah.
Any more questions?
It's not so much a question, it's just observation. I just find that with doctors, my eczema, most of the time I can control it, but if I've run out of my hydrocortisone cream, I've got to let it get really bad, scratch it a bit, make it look worse, because now I can't even get an appointment. They want a photograph of it, and trying to get it before I'll get any more hydrocortisone. So, I've had all this all my life, and I'm in my 60s now. They don't accept that I know how to control my eczema myself, and this is what makes me really cross, is that, just to get a tube of hydrocortisone, and I don't use it all the time, but if I can put it on as soon as I start getting some patches, I've only got to use it for a few days, and then I can not have to use it anymore, and it can last me a year or more. But trying to get that over to the doctors, they just won't accept, all right, you need some, we'll give it to you. They want to see that your eczema is really bad before they'll give it to you. And I think that this is what I find really annoying, is that they won't accept that you know how to, it's your condition, you've lived with it, that they should allow you to take some control over it.
Yeah, and then try and prevent it from...
my emollients, I've never got emollients from doctors. I've found it better just to buy them and try them myself, because I know how difficult it is for people to, get the emollients from their doctors. So, I hate to think how many thousands of pounds are wasted because you buy them and you just bought a new lot and then the skin decides it doesn't like it anymore. So, you end up chucking it away. But this is what I find really difficult, is that the doctors, eczema, unless it's obviously really bad or really bad in a child, they do realise how bad it is, but for most people that just suffer with it normally, where can be a minor irritation, but it seems to have to be a big irritation and impact your life more before they do anything about it.
Yeah, that makes me think when we were developing the care plans, we had groups with lots of people with eczema and health professionals discussing really similar things. So sort of the fact that you obviously want to look after your skin and stop yourself from having a flare-up, but often GPs, for example, might not have very much specialist training in eczema. They don't really understand, they might not be aware of that. Also, I remember people talking about not being given enough of a treatment. So like, for example, using like the fingertip guidance, people not realizing how much you should use. So that's a really big problem. I guess, again, having care plans can be quite useful to facilitate discussion around that more, and you can also kind of keep them over time and bring in old ones to show, look, this is what I was told by a particular person. I guess trying to speak to somebody who has a special interest in dermatology if possible, but it can be helpful, but that's not always possible.
GPs that do. This is the trouble.
Yeah.
I've never come across a GP that's really had special interest in skin.
Yeah, I think again it's another thing I was talking about, how it would be useful to have training for GPs which is developed with people with eczema and other health professionals around the kind of broader impact. I think if you would do that, you would also need to have the basic sort of dermatology training in there. So both these things would need to go together, wouldn't they? But yeah, you're right, it's something that's really difficult, isn't it, and frustrating.
It is frustrating, and then it impacts your life. Something that shouldn't impact your life starts to impact on your life.
Yeah.
I stopped going swimming because of the water affecting it.
Yeah.
I'm not too careful. I don't particularly care what people, if they see it, think of me. I'll just say it's eczema, But it's just the fact that the stuff they put in the water will then make will irritate it.
Yeah. So it's just like another barrier.
I've even found can't go to parts of the country, Devon, in some places in Devon, they put so much chlorine in the water. I can't go there, you can't shower because the water's horrible. It affects your skin so much, so
Yeah.
it stops you going to certain places on holiday even
Yeah.
because of it.
Yeah, and that's difficult if that's a barrier because you're not being given access to something that you should, like an additional thing. Yeah.
Thank you.
Yeah.
I think it's really interesting that you focus on the sort of psycho-immunological aspect of things. So we know that psychological stress is very much linked to physiological and that can sort of lead to flare-ups, as you're saying. I think it's very interesting that you're trying to reframe sort of certain thoughts as well to reduce stress. In your research, have you noticed these techniques actually do reduce sort of physical health sort of flare-ups and requirement for steroids, or is it more just that you're sort of augmenting moods and sort of the psychological aspect of your experience?
Yeah, so I haven't necessarily done particular studies looking at that, but studies that there have been, I think there is shown that if you can reduce stress, that does then reduce symptoms. And I guess part of that is the sort of, like you said, the psychoneuroimmunological link and response. But I suppose also if we're stressed, we're more likely to scratch and things like that as well. So it's also by feeling like managing stress, we're probably doing less things that will exacerbate our condition as well. But yeah, there are studies that do show that those things are helpful.
In preventing flare-ups or just making flare-ups worse when they do occur?
Good question. I'm not sure. I would have to look, but I can send you some papers and stuff. But yeah, definitely helping physically, and so that lots of studies do show that physical symptoms definitely improve from psychological interventions. Yep.
I was just wondering if you're aware at all of the psychological impact some patients might have of using these strong steroids and other treatments as well that you can have, and just to kind of worry about how they might affect you long term.
Yeah, I mean, I again haven't done any specific research into this, but I know that there is some research. I think actually there's research looking at people's experiences of using steroids and steroid withdrawal in Nottingham. So if people are interested in that, they should have a look into that. But yeah, obviously that it can be a big thing for people, and I guess it can really shape your identity as well when you feel like you're relying on something that feels quite like strong or quite serious in terms of treatment. And people obviously do have worries about the long-term effects of certain treatments. So obviously that can be worrying for people. I think often it's like a balance, isn't it, for people thinking, I want to keep control of my skin so that I feel like I can manage and not having these symptoms, but also I'm worried about what will happen from using this treatment. I think using treatments that are recommended is the best thing to do, isn't it, to follow advice. I know at the moment there's lots of information on social media, for example, and it's become this massive thing where people are sort of turning against certain treatments, but I think it's always best to follow the advice of trained professionals who know best, obviously. But yeah, of course, worrying about using treatments and worrying about the long-term impact of things, obviously that is going to affect people's well-being as well. So that's obviously something that is important to talk about when you see a health professional as well, if that's a concern for you, and get them to talk you through the current evidence and what they think the best thing for you to do is. Yeah.
I feel like I struck lucky in a way. She wasn't a bad dermatologist, but she pretty much said to me at the time, "You've got the worst eczema I've ever seen." Sorry, information about that. And it was me that said, I wanted to see someone else, and I was so lucky. I got a really good doctor. Sorry, I didn't know I was going to get so emotional. If it wasn't for her, I wouldn't be where I am now, feeling better about things. But it does still worry me, these treatments.
Yeah.
Like you said, the toxic withdrawal thing. That's across social media. There are accounts of people scaring people.
Yeah, there's lots of stuff on social media, and yeah, I think it's really difficult to sometimes think critically and think what's credible, what's trustworthy. It's really hard, isn't it? So like you say, the best thing to do is to speak to somebody who is an expert, who knows that. And sometimes as well, if you need to manage your skin, you do need to use treatments, because you need to do that to look after your skin. And so you have to find the thing that works best for you with guidance.
Yeah, it makes such a difference if you're not happy with your doctor, to find someone who will listen. The one I got now she's so good, she's so caring, it makes such a difference.
Who's this angel?
She's good. She's very good. But it makes a difference. I do recommend, if you're not happy with whoever you're seeing, to see if you can speak to someone else.
Yeah.
Because you never know what difference it might make.
Yeah.
Definitely.
Good piece of advice. Yeah.
Just the effect of stress, I think, is under acknowledged by a lot of people, just because you don't know. But whenever the National Eczema Society has done surveys on what triggers people's eczema flare-ups, stress is always the number one trigger, most common cause of a flare-up. After that, it's seasonal change in temperature, but stress is always the biggest one. And that whole mind-skin connection thing, I guess we're just learning more about that, but actually it's a really significant thing for a lot of people. And if you can, it's not easy to say don't stress, because often we get contact from people when, at National Eczema Society, when they're exam time for students, or moving house, or changing job, or all the times they're getting married, all those times that are stressful naturally. But obviously it can really affect people, and if you can manage it, I think anecdotally we hear that it does, can help people enormously actually, in terms of just managing both their mental well-being as well as their symptoms.
Definitely, and we treat physical health conditions using a biomedical model, don't we? And so that doesn't really think about the biopsychosocial aspects and how they will interlink. It's just it's not the norm, it's not how things are typically treated, but obviously, as you say, it's really important. Stress, is a massive cause of flare-ups, and you can't always avoid stress. You can't, it's just, stressful things do happen. We can't live our life not being stressed, and it's also not helpful when if a health professional says to you, just don't get stressed. Okay, great. that can make you feel worse, can't it? But it's really important. But also, I suppose, as I mentioned earlier, like the thing with going to a physio, if you can do things that are good and help you, even if it's stuff like going out for a walk when it's sunny, or whatever it is, doing that when you feel good as well, that will help you to manage stress. It's much easier if you've learned those skills when you're feeling good. It's much easier then to employ them when you're not feeling great, or to kind of, sometimes they can stop us from feeling so bad, whereas when we have to do something when we're already feeling really awful and we're trying to learn something, it is more difficult. But stress is definitely a big one, and you can't avoid stress to an extent. Thanks.
Any more questions? No. Well, thank you, Dr. Allen. That was really interesting, and thank you for taking the time. And I forgot to say at the beginning, if you are Welsh, if you're in Wales, happy St. David's Day. So thank you.